I'm 36 years old and I'm about $3 million in medical debt. After a heart attack, open heart surgery, and life support, I was 8 weeks in the hospital. I'm a retired veteran or medically disabled veteran. And you would think they would cover it. I showed a video like this when I first got to the hospital back in November, and I showed this bill right here, totaling $500,000. And everyone said, it's not $500,000. You only owe $22,000. Your insurance paid the rest. Yes, you're correct. But what about these other hundreds of bills that I haven't even opened some of? Let me give you an example. This one says amount $1,400. Veteran responsibility. The VA only covered $400. I owe $12. Let's get another one. $1,200. $22,000. Veteran responsibility $500. VA only approved $134. I owe $424. Veteran responsibility $2,080. The VA only approved $432. I owe $1,647. I could keep going with this. I have hundreds of bills that I haven't opened. I don't know when I'm going to get around to it. It gives me anxiety. Yes, I'm still on hundreds of medications that I need to survive. Good news is I just got pulled off of dialysis. I no longer need dialysis. Well, I surgically have this placed into my chest, this device, as you can see here, and it needs to be removed surgically, anesthesia. Guess what? The hospital that put it in called me yesterday and told me the VA denied it. The VA did not give them the green light to remove it. So I'm stuck with this fucking catheter in my jugular vein through my chest, and the VA won't approve of removal. You wonder why people are pissed off at the American health system. I have millions of dollars in debt after just surviving surgery, open heart, life support, medications for years to come. And they can't approve a fucking catheter removal? This is bullshit. America, get your fucking shit together.
Medical debt is the #1 cause of bankruptcy in America. Not credit cards, not bad decisions, simply getting sick. Medical debt contributes to 2/3 of bankruptcies in America. And what's more shocking is that most of these people had insurance. So you work, you pay your premiums, you do everything right. Then one diagnosis, one accident, one illness, and all of a sudden you're drowning. And when you can't pay, debt collectors, wage garnishment, eviction. So medical debt doesn't stay medical. It becomes credit card debt to cover the gaps, then rent you can't pay, then eviction. Then if you manage to survive being unhoused, you get arrested for sleeping in public. This leads to fines you can't pay, bench warrants. Now you're in the system. One health crisis, 3 systems designed to catch you. Healthcare, housing, criminalization. They are connected. They don't fail separately. They function together to turn a patient into a prisoner. And the people who designed this profit every step of the way. So as you follow this trajectory, you must ask yourself, is the system really broken, or is it working exactly as intended?
A lot of us over there struggle with medical debt. How do you handle your medical debt?
I don't have any medical debt.
Why?
Well, Canadian healthcare system is it's free.
Hey friends, I've come to the city of Detroit to get to the very edge of America, because over there, Windsor, Canada. Now, it's not very far. What separates us is a river, but also a whole chasm of political will to guarantee people health care that they need and deserve. Because on this side of the river, if you get sick and you don't have insurance, you may not be able to see a doctor at all. You might go to an emergency room and then get hit by the bill, which may cost you your home or worse. On that side, well, let's go see.
In Canada, we're lucky, actually. Yeah. We're a lot luckier than the US.
So you just don't have to pay anything?
We don't have to pay anything.
No debt. You've never had medical debt?
No, not yet.
Like anybody in your family have medical debt?
Not that I know of.
But no debt?
Not at all.
Okay.
Yeah.
I don't have the same concern about medical health as you have in the States.
This is a crazy thing. So what would you all say if I told you that our medical debt is $225 billion in America?
That's crazy.
For 41 years, I've lived on that side of the river where people go bankrupt for getting cancer, where people have to choose between whether or not they'll pay their mortgage or they'll pay their healthcare costs. And it's crazy. We don't have to live like this, just a river away. These folks don't worry about medical debt because it doesn't exist.
Imagine being just 33 years old and carrying millions of dollars in medical debt. Now compare that to people in neighboring Canada, where many medically necessary hospital and physician services are publicly funded. Why are two countries with similar economies facing such different healthcare experience? Today we are looking at these stories, the facts and the debate behind one of the biggest issues affecting millions of families. Let's watch more clips and we come back to talk about it.
My husband and I received a medical bill in the mail yesterday, which happens a lot because we have horrible insurance. Hey, Cigna, take that. I need someone to explain this one, however, to me like I'm 5 years old, because I don't understand what the fuck is going on. I don't understand the American healthcare system as a whole, but this bill specifically, really don't understand this. Need y'all to help me get there. Let me explain what this is for. My 5-month-old daughter had a fever last month. We bring her to the doctor like any responsible parent would. They do a nose swab to test for the flu, COVID, all those things because it's cold and flu season. Good decision, right? They send it off. She's good. She's got none of it. The fever goes away in a few days. Great. I assume we're gonna get a bill for it because we have horrible insurance. Hey, Cigna. But do I expect to receive this bill? No. I Google it because I'm curious, how much this might cost us. Google says that the max amount in most situations that you'll pay for something like this is about $300. I was like, whoa, that's a lot of money. $300, that's a lot, but hey, it's worth it. That's our baby. Of course, we'll pay for that. No big deal. And maybe our insurance will cover a bit of that. So maybe it'll only come out to like $100. We pay for insurance. Maybe they'll do something. Get this bill in the mail yesterday, and when we open it, to our surprise, not $100, not even $300. At this point, I would be happy to see $300. It was not $300. I want you to take a moment to think about it and guess. What would you assume a cotton swab up the nose would cost? Take a guess. Your guess was $984. I don't know why you guessed such a specific number, but you'd be right. Now, this is the part I need explaining. Why does a nose swab that when you Google it says it won't cost nearly $1,000 cost $1,000? Hey, what the fuck is going on? What do you mean by that? $1,000 for a Q-tip up a nostril? What? Sitting here thinking, why do we have insurance? Why do we go to the doctor? If we went to urgent care, this would have been $50. $50. Done. Oh, speaking of insurance, do you want to know how much they covered? If you guessed like the majority, you would be wrong. If you guessed basically nothing, you'd be right. They covered less than half. We owe $443.27 for a flu nose swab. Why do we have insurance? I need somebody to explain this bill to me. Like, how does that make any sense? How does it make any sense to charge $1,000 for a nose swab? And how does it make any sense that we're paying for insurance that covers less than half of that?
After watching these stories, it's clear that healthcare isn't just a political talking point. It's something that can shape people's lives for years. In the United States, medical debt affects millions of people, and unexpected medical bills can create long-term financial stress for many families. Canada takes a different approach. Its publicly funded healthcare system covers medically necessary hospital and physician services for residents, though it doesn't mean every service is free. Prescription drugs, dental care, vision care, and some other services often require private insurance or out-of-pocket payments. Neither system is perfect. Americans often have faster access to certain specialized treatments and more private healthcare options, while Canadians sometimes face longer wait time for non-emergency procedures. The real question isn't which country is perfect. The question is whether any family should have to choose between getting medical treatment and risking financial hardship. Healthcare affects everyone regardless of political party. Whether you're a conservative, liberal, or independent, illness doesn't ask who you voted for. So what do you think? Should the United States reform its healthcare system, or is the current model the better approach despite its challenges? Share your thoughts in the comment respectfully, and before you go, do well to like and subscribe to my channel. I'll see you in the next.